Tonight, record COVID figures yet again. Another A&E says don't come unless your condition is life-threatening. And staff say they are overwhelmed.
At the moment, we have no beds for surgical admissions. I don't know that we'll ever recover from COVID.
Latest figures show 1 in 11 people in Scotland has COVID. Also making the headlines. Are we facing milk shortages? The boss of one of Scotland's largest dairy companies thinks we are. And happy first birthday to Billy, the baby born after his mum Michelle woke from her COVID coma. I'm John Mackay. This is the STV News at 6. Good evening. I don't know if we'll ever recover from COVID. The words of a leading medic at a hospital that has told people to stay away from accident and emergency unless their condition is life-threatening. The department at Paisley's Royal Alexandra Hospital is the latest to be overwhelmed. COVID infections have been rising for 8 weeks now and have reached another record high. Nearly 500,000 people, or 1 in 11, had COVID in Scotland last week. That's up from 1 in 14. Our reporter Vanessa Kennedy has been inside the busy A&E where staff say they're struggling to cope.
This is just one of the hospitals in the Glasgow area that's urging people to stay away from emergency departments unless absolutely necessary. With the number of patients in hospital testing positive for COVID at a record high, doctors say they're facing unprecedented pressure and much of the workforce is exhausted.
We've not seen demand like this for several years, along with staffing issues as well. People are laying in the corridors for hours at a time. We're trying to do the best we can with the resources we've got, but we are struggling. It's just absolutely overwhelming. Sometimes we have 40, 50 patients in the department at midnight. That never used to happen before.
And the problems are not just in this hospital. Waiting times in accident and emergency departments across Scotland have been the worst on record this week. And hospitals are seeing the highest number of patients with COVID since the pandemic began. Patients admitted for other ailments who later test positive for COVID means more beds have to be used for isolation, leading to even more pressure on resources.
Is there a beds crisis at the moment? Yes. At the moment, we have no beds for surgical admissions. And that is as a consequence of wards that are closed because of COVID. I don't know that we'll ever recover from COVID. I think there is a lot of non-COVID harm which has been done to people, both in terms of physical illness and also in terms of the psychological impact.
Now, NHS Lanarkshire is the latest health board to warn people not to attend accident and emergency departments unless their condition is urgent or life-threatening. Vanessa Kennedy, STV News.
We're joined now by the Health Secretary, Hamza Yousaf. And Mr Yousaf, 1 in 11 cases. Now, how far can you let this go?
Well, look, these record levels of infection are really worrying, and of course they are concerning. On top of that, of course, we have record numbers in our hospitals with COVID. What I would say is that thankfully, due to our excellent vaccination programme and our booster programme in particular, we're not seeing those numbers necessarily translate into the same degree into ICU, severe illness in the way that they would have done in previous waves. So it's important that, yes, we of course begin to adapt, to learn to live with COVID, but that people still continue to follow the rules. And there are still, for example, rules in law, but also public health guidance, and continue to test themselves regularly and practice good hygiene. Because if we control COVID, then of course it begins to alleviate some of the pressures that our NHS is facing.
Why does Scotland have higher rates than the rest of the UK, despite having tighter restrictions?
So the clinical advice that we receive about the high levels of infection in Scotland are due to the dominance of the BA2 sublineage. So around about 90% of our cases 90% of our cases are BA2 cases. Now, I've seen also, and you've seen in those ONS figures, that the number of infections and the infection level in other parts of the UK is also rising. So they may just be behind us on that curve.
People are being urged not to go to A&E because of the pressure on hospitals, but neither can they get appointments at doctors. So what are they supposed to do?
Well, I don't agree with that characterisation. Our GPs are working extraordinarily hard. I know GPs are still under pressure, but there are other alternatives. So, of course, if you're facing an emergency, the right thing to do, of course, is to phone 999. If it's not an emergency, then, of course, phone 111, where NHS 24 is, of course, the name suggests, is available all hours of the day, all hours of the night to assist you. We also have, of course, out of hours GPs, we have minor injury units, we have, of course, pharmacies and Pharmacy First, who could also help you with a number of inquiries that you may well have. So if it is an emergency, of course, call 999, but there are other alternative avenues open to people.
We heard in our report the medical director of the Royal Alexandra Hospital in Paisley questioning whether the NHS can recover.
It can recover, and I was at the RAH myself just a couple of weeks ago. It can recover, and it will recover, I'm certain of that, but it won't happen overnight. It won't be weeks or months, but the recovery of the NHS will take years, because the NHS is suffering the biggest shock it's ever faced in its entire 73-year existence. I don't think anybody argues with that. So the recovery will take time. But actually, even if I look at just last year, between October and November last year, that was between the Delta and the Omicron wave, we saw scheduled operations in the NHS increase by over 20%. So when we get that COVID transmission under control, we can absolutely recover our NHS. I've got no doubt about that.
The whole point of lockdown was to ensure that the NHS was not overwhelmed. That appears to be happening. Does that suggest that all that we've gone through was a waste of time?
No, not at all, not at all. We are in a significantly better position now than we were in March 2020 when we were in that lockdown, if I think 2 years ago, and where we were, and a better position than March 2021. Actually, those efforts undoubtedly helped us at that time. The big game changer is the vaccines. We now have an excellent vaccine rollout programme, and that includes the booster programme too. And that has been the game changer, because although we have these record numbers in hospital with COVID, thankfully we're not seeing the same translation into ICU that we would have seen if we didn't have this vaccine programme. So we are in a far better position. For most people, life feels like it's getting back to a fair degree of normality. Again, that is really down to the action we've taken, coupled alongside, of course, the vaccine programme.
Health Secretary, thanks for joining us in STV News.
Thanks, John.
The boss of one of Scotland's largest dairy companies is warning we could be facing milk shortages later this year. Robert Graham from Graham's Dairies says the projected amount of production won't be enough to meet demand. He believes economic pressures on farmers are a major factor, but retailers say they don't expect customers will see empty shelves. Here's our senior reporter, Gordon Crete.
This is diversified dairy at Graham's plant in Cowdenbeath this afternoon. Yoghurt protein pouches were flying off the lines. These products are becoming increasingly popular, but milk is still the core business, with the company selling 200 million litres a year. But with costs for farmers rising, the fear is some simply won't be viable. And across the industry, the supply of milk by the autumn could be 10% less than what's needed.
We're fortunate with the supplier base of farms that we have. We're predominantly all Scottish family farms, well invested, do a great job, but we have to get more return from the market to be able to get more money back to them because of their increased costs.
One of the big problems for the industry is that in real terms we're paying around 40% less for our milk in the shops than we were a decade ago. But the cost pressures on producing it are much higher than they've been. Graham says it's already paying farmers 50% more than it was 2 years ago, and anticipates that will have to rise further if keeping herds going is to be viable. The retailers are confident a solution will be found.
I'd be really surprised if kind of dairy farmers, retailers couldn't come to some sort of accommodation to do that. It's the interest of both sides. Retailers want to sell the Scottish milk on the shelves, and the farmers want to be supplying it here too. Now that's going to involve lots of negotiations. There'll be a lot of work to do it, but I really wouldn't expect there to be shortages, certainly in the perceivable future.
And that's likely to mean we'll all be paying a bit more for our milk to ensure it's worthwhile for it to be produced. Gordon Cree, STV News, Cowdenbeath.
The RMT union is calling for more investment in CalMac's ferry services. Members have launched a campaign in Oban calling for sailings to be more reliably and affordably run, something echoed by the locals and businesses who rely on it. The Susan Ripple reports.
The 12:30 to Mull was on time today. In fact, it left Oban 5 minutes ahead of schedule. But it's not always like this.
How would you sum up your experience of the ferry service?
Frustrating.
And deteriorating.
Especially over winter, I think with the weather and that kind of situation, it gets cancelled quite frequently.
More services would be great, yeah. I mean, especially for people who need the ferry. I just purely leisure for me.
The ferries are important to businesses here too, especially when your target market is tourists.
If there was more ferries on, it would encourage more people to come in to the town. And of course, if it's cheap as well, if people can afford to use the service, then that's going to encourage more people to come in. So I do think that it does have an impact.
And these are the kind of improvements the RMT union wants to see. It's calling for more investment in the service.
One of the real concerns is the ageing fleet. And while there are new ferries coming, the union says it's not happening quick enough.
They're not reactive enough to the needs of the workforce and the needs of the communities that use them, and that's really what we're here. We're not here to have a go at CalMac, we're here to say, let's work together, let's make things better for everybody at CalMac, the workforce who we represent and island communities who rely on CalMac.
But I'm pretty receptive to some of what RMT have to say, and I'm keen to meet with them to discuss the campaign in a bit further detail. Recognising, I think, some of the challenges that have affected our island communities throughout the start of this year, I know, in terms of service provision on the CalMac network.
There's hope things will improve, but given how many here feel, it's no wonder this isn't the name of the CalMac ferry. Susan Ripple, STV News, Oban.
Other stories across Scotland, and strike action by Glasgow City Council workers in a dispute over equal pay has been called off. Staff had intended to walk out on Tuesday and Wednesday of next week, leading to the closure of schools across the city. The GMB union says its members will suspend their action after assurances by the council that interim payments will be issued by October. Ukrainian refugees will be able to access health care and some benefits when living in Scotland. People fleeing the war can access services such as maternity care, mental health support and treatment for specific conditions at no charge. Those who are eligible can also access the Scottish Child Payment and Child Disability Payment. Young people across the country have taken to the streets in protest against what they say is a lack of action to tackle the climate emergency. More than 700 protests took place worldwide as part of the first global youth strike since the COP26 climate conference in Glasgow last year.
So this is the Fridays for Future Global Climate Strike. It's a global day of action. Everyone's here because we're demanding that we see climate justice and we see people, not profit. We're tired of seeing that money is being prioritised in our society in the global north, and what we want is people to be put first as well as the planet.
The Prime Minister has backed calls for the immediate resignation of the Chief Executive of P&O Ferries. Peter Hebblethwaite admitted to a committee of MPs yesterday that the company broke the law when it sacked 800 workers without consulting unions. The RMT has said it will meet with P&O tomorrow to demand the reinstatement of staff. The new Edinburgh tram line to Newhaven is on track to open in spring next year, despite some construction delays. Edinburgh City Council say the project to extend the line is within its £207 million budget and is already around 70% completed. Well, following days of sunshine and the growing popularity of wild swimming, you might expect the sea, rivers and lochs to be busy this weekend. But if you're planning to dip your toe in the water, you're being urged to be careful. Following a spate of deaths last summer, school pupils are to be given water safety lessons, and signs around lochs and reservoirs will be improved. It's part of a new water safety action plan drawn up by the Scottish Government. Ollie Dickinson has more.
Call 999, try and stay nice and calm, float if you can. I'm going to get a rope out to you.
Life-saving training on Scotland's waterways.
Whilst this might only be a drill, it's a crucial part of a range of measures being introduced to make Scotland's open water safer.
It's so beautiful in Scotland and we want people to go out and enjoy Scotland, but we wanted them to do it in a safe way. We've got a new educational resource and we've got people like our rangers and the fire service that are going to be going in and talking to kids about how to enjoy Scotland's waters safely.
This drone footage of Balloch Shores shows how just a few feet from the lighter coloured shallows and relative safety, dark, cold water as deep as 30 feet is just yards away. Falling into it could be fatal.
They could be picnicking very close to the water and think, I'll just go in for a paddle. But remember, it can actually drop off very steep, very close to shore, so that people are maybe not aware of that. And again, with the good weather, you're having an ice cream, you're playing, that sort of concentration maybe lapses at times. 9
people died in Scotland's waterways last summer, 6 of them across one weekend. Lamar Maynard drowned near Loch Lomond in the River Leven in 2006. Since his death, his sister Lauren has campaigned for greater education on water safety.
It's most people from suburban areas and they go out to the rural locations, so they're not aware of water shock, how deep these lochs are, reservoirs are, and they just see the water and they want to take a cool dip. So it's really important that we show anybody that going into the water beforehand is at an absolute risk and a really high risk.
On a day like today when the sun is shining, the waters of Loch Lomond can look inviting, and whilst the temperature out here is around 15 to 16 degrees, the temperature in the water is much more like 5 or below. And it's that sudden change in temperature that can catch people unaware.
Scotland's waters are cold all year round, and the cold water shock is the thing that can even give the most experienced swimmer a lot of trouble in the water.
Scotland wants to reduce the number of accidental drownings by 50% in the next 4 years. Even with the measures introduced today, many fear it will once again be a busy summer for life-saving services on our country's waters. Ollie Dickinson, STV News.
Maybe over lockdown you tried your hand at chess after being inspired by programmes like the Queen's Gambit. Well, 2 university graduates took their risk and produced 3D printed chess pieces, but with a Glasgow twist. Our reporter Ivana Holland went to meet the 2 engineers changing the face of the board.
Not all in business is black and white, but a chess set featuring Glasgow's most iconic landmarks has proved a hit with those who want to see the sights on a smaller scale. These Glasgow uni graduates have been shocked by their success.
Our first chess set we sold, I drove to Ayr to drop it off to the customer and spent about an hour with her. It was a gift for her husband and we set it up in a garden and stuff, so that was a great sort of moment for us as well. It was an incredible feeling. That was good, yeah.
Featuring some fan favourites like the Duke of Wellington as the knight and the armadillo as the pawn, the 2 engineers explained why they stayed so close to home.
Glasgow doesn't really get a lot of love, for example. Like you can go and buy a model of Big Ben or at the Empire State Building, but you can't get the Glasgow Uni Tower or the Finnieston Crane, for example.
Their next move is as strategic as the game itself, as the Glasgow success has led to an Edinburgh expansion.
After that, we were planning to maybe go down and look at places like Manchester, Liverpool, Dublin, and just more kind of underappreciated places.
We're also going to do a Glasgow versus Edinburgh set soon as well, possibly. So just obviously one side of the board, Glasgow, Edinburgh, get the rivalry going as well. So.
Back at the workshop, the guys managed to fit in production around their full-time jobs. Each 3D model takes around 10 hours to print and months of research.
So that actually involved going to the sort of landmark, taking sketches, taking photographs, looking on Google Maps and Google Images just to build up a kind of plan of how we would design it. We then use a 3D CAD software that we learned to use in uni, just to build up sort of layer by layer the model. It's almost like being a sculptor, but just on the computers.
Now they're on to the business of printing the real fan favourite. Ivana Holland, STV News, Glasgow.
Now Sean has the weather, and the message is don't look beyond the weekend.
Well, many of us this week have been getting used to lots of lovely sunshine, feeling very pleasant as well. Those temperatures getting to the mid-teens, even the high teens in the odd spot. And it's here to stay for the weekend, so that's good news. But as I've been saying all week, there's going to be a change next week to colder conditions and even the risk of some wintry showers around as well. Well, enjoy the weekend. Let's have a look at your forecast.
The outlook for the day is calm and settled. TUI Blue Hotels sponsor STV Weather.
Well, get ready for a fab weekend ahead. High pressure centred right over the top of us. A lot of pleasant, bright weather to come, but make the most of it because it's back to the winter woolies next week. A cold Arctic airflow heading our way, so quite a drastic change in temperature. By next week, probably we'll be looking at highs of around 6-7 degrees, especially later on in the week. So big change from what we're getting used to. But let's enjoy the weekend first of all. Lots of clear skies around tonight. We've got a lot of sea fog developing around the southwest, wrapping its way around Arran, the Kintyre Peninsula tonight, across Islay, also into lights of Millport, perhaps also Bute as well, mainland coastal parts of Ayrshire as well. But most of that clearing away into tomorrow morning. And look at that lovely blank map. That's good news. Lots of lovely sunshine around. Light winds, temperatures 16 degrees Celsius. So it is going to feel very pleasant, those temperatures into low 60s in Fahrenheit. Now, the sun is, of course, getting stronger all the time now as we head into spring, peaking out June and July. So the UV levels are now starting to rise. So just something to bear in mind if you're out in the garden for any length of time. I hope you are this weekend, enjoying that sunshine. But we are now heading into a level 3 on the UV index, and that means it's time to start thinking about suntan lotion. So just something to bear in mind, as I said. Sunday, lots of lovely sunshine again for many of us. Highs 16 to 17 degrees. Enjoy.
TUI Blue Hotels sponsor STV Weather.
And finally, some good news. A mother who battled COVID in hospital while pregnant is celebrating her baby boy's first birthday. During her time in ICU, Michelle was fearful the pair wouldn't survive. Now she is raising money for those who cared for her. Greg Ockram reports.
Happy birthday to you.
The moment Michelle thought she'd never see. Surrounded by family celebrating son Billy's first birthday.
There you go.
While 6 months pregnant, she caught COVID and spent a number of weeks in the ICU ward at Crosshouse Hospital. During that time, doctors treated her for pneumonia, pleurisy and blood clots and was placed in an induced coma. She spoke to STV News last year about what she called the scariest time of her life.
Scared for life, and I'm scared for Rachel's life. They told me if I had an emergency C-section, I would probably have to pick up from it.
As a small gesture to the staff that cared for her, Michelle and the family are now raising cash to help others in the ward.
My family and I are climbing Goatfell in June to raise money for the intensive care team that saved both our lives, for everything they've done for us, not just the care that they had to give us when we were in hospital, but the support that I've had from people since, the aftercare that I've had. They have a genuine care for us and for Billy. I'm just eternally grateful.
Memories of her time in hospital are never far away. She's still being treated for long COVID with scarring on her lungs. But today it's celebrations for a life she feared would end before it began.
It just feels so unbelievable that he's here and he's so healthy, and I've got all my family around us, they've got us and we've got them.
Greg Ockram, STV News.
Happy birthday, Billy. And before we go, pictures of another cute baby. Well, it is Friday. Brody, the baby polar bear, has made his debut appearance at the Highland Wildlife Park. He's being billed as a big deal for conservation, a boost to the survival of the species, which is under threat from climate change. And that's all from us tonight. From all of us here, thank you for watching and enjoy the rest of your weekend. Have a good night.